The condition and rehabilitation of the St. Judes Hospital is considered a prevailing issue subjected to heavy debate and critique. The medical institution housed at the George Odlum Stadium at Beanfield, Vieux-Fort, has been plagued by many challenges such as structural instability and a lack of medical supplies, which has hampered staff for many years. This reality has prompted the Minister for Health, Honorable Jn Baptiste, to address the ongoing rehabilitation campaign, which will be continued to create suitable conditions for patients and staff alike.
The rehabilitation of St. Judes Hospital, 1.5 million. The rehabilitation, Mr. Speaker, of St. Judes Hospital at the stadium. And the opposition continues to say, if we are building a hospital, why are we doing work at the stadium? I keep saying, Mr. Speaker, that we are dealing with human beings, and this government will not abandon its responsibility to ensure that even though we are at the stadium, the conditions there are improved. We started this project last year, Mr. Speaker, in 2022, and we have realized the following. We have removed the east and west wing canopies, Mr. Speaker. More remediation in the admin building. Refurbishment of the resuscitation bay in the emergency room. Refurbishing of the triage area. Refurbishing and reconstruction of the West Wing security booth, refurbishing of the outpatient department, refurbishing of the microbiology and parasitology department in the lab, refurbishing of the inventory warehouse, more remediation, drainage works, the construction of a canopy for water diversion for the inventory containers.
Minister Jn Baptiste goes on to cite developmental efforts that are currently being done within the facility, along with the future priority which is being given to departments such as the administrative building.
If you go to the stadium now, Mr. Speaker, everybody who passes there can see that we have reduced all of these disasters waiting to happen, Mr. Speaker. Mr. Speaker, some additional funds are earmarked, and we are going to continue to do some work, rehabilitative work on the admin building, the solar water system, the washroom, showers, more remediation, a septic tank and sewer system. We need to reconstruct that, Mr. Speaker. The rehabilitation of the operating room and day surgery unit, plumbing system, and other rehabilitative works, Mr. Speaker.
The Minister for Health thanks all individuals and organizations responsible for aiding the government in the enhancement of medical facilities on the island.
I wish to thank Mrs. Jeanette Hughes of the Health System Strengthening Project and the OECS project and her team for all of the work that they've done. I wish to thank Mr. Jn Baptiste, although I wish to express condolences on behalf of the whole Parliament. We know what he's going through now, the passing of his wife just a few days ago. But he is one of the key individuals in the ministry who works with the Health System Strengthening Projects on the PBF project, Mr. Speaker. And a lot has been done. What have we attained, Mr. Speaker, over the last couple of years, Mr. Speaker? Provision of phlebotomy services to clients with diabetes and hypertension. Mr. Speaker, 290 persons accessing service from the Millennium Heights Medical Complex, from Denry Hospital, Richmond, Jacmel, Lacroix. 2,194 persons accessing services at the St. Judes Hospital, the Soufrière Hospital, Monrepo, Deriso, Lafargue Wellness Centers.
Current remodeling efforts being undertaken at the St. Judes Hospital serve as an indication of the government's dedication to preserving and enhancing the public well-being of our society. For Choice News Now, this is Obi Offor reporting.